Hello everyone, welcome to my YouTube channel. Tongue cancer is a type of cancer that starts in the cells of the tongue and can cause lesions or tumors on your tongue. It's a type of head and neck cancer. Tongue cancer can occur on the front of the tongue, which is called oral tongue cancer, or it may occur at the base of the tongue, near where it attaches to the bottom of your mouth. This is called oropharyngeal cancer. Squamous cell carcinoma is the most common type of tongue cancer. What are the symptoms? The most common early symptom of tongue cancer is a sore on your tongue that doesn't heal and that bleeds easily. You might also notice mouth or tongue pain. Other symptoms of tongue cancer include a red or white patch on your tongue that persists, a tongue ulcer that persists, pain when swallowing, mouth numbness, a sore throat that persists, bleeding from your tongue with no apparent cause, a lump on your tongue that persists. What causes it and who's at risk? The cause of tongue cancer is unknown. However, certain behaviors and conditions can increase your risk, including smoking or chewing tobacco, heavy drinking, being infected with human papillomavirus, HPV, a sexually transmitted disease, chewing beetle, which is particularly common in South and Southeast Asia, a family history of tongue or other mouth cancers, a personal history of certain cancers, such as other squamous cell cancers, a poor diet. There is some evidence trusted source that a diet low in fruits and vegetables increases the risk of all oral cancers. Poor oral hygiene, constant irritation from jagged teeth or ill-fitting dentures can increase your risk of tongue cancer. How is tongue cancer diagnosed? To make a diagnosis, the doctor will take a medical history and ask specific questions about symptoms. A patient's tongue and neck will be examined and a small, long-handled mirror will be used to look down the throat. Several tests are used to aid in the diagnosis. These tests include X-rays of mouth and throat, including CT, computed tomography, scans, X-rays that show images in thin sections, PET scans, positron emission tomography, which use radioactive materials to identify excessive activity in an organ. This may indicate the tumor is growing. Tongue cancer usually requires a biopsy, a small sample of tissue that is removed from a tumor to diagnose cancer. After the surgeon removes the tissue, a pathologist will examine the cells under a microscope. There are different methods to obtain a biopsy. Fine needle aspiration biopsy. A thin needle is inserted into the tumor mass and a sample is drawn out by suction into a syringe. Incisional biopsy. A sample is removed with a scalpel, surgical knife. Punch biopsy. A small circular blade removes a round area of tissue. How is tongue cancer treated? Surgery. Oral tongue surgical removal of the primary tumor might be the only treatment needed for small oral tongue cancers. If the tumor is large, it may have spread to lymph nodes in the neck. When this occurs, the surgeon may recommend removal of the affected lymph nodes in the neck. Most small cancers of the oral tongue leave little cosmetic or functional changes after they are removed. Larger tumors can spread and make it hard to swallow. Surgery for large tumors also affects speech and swallowing. With the latest reconstructive techniques, our doctors are able to restore most speech and swallowing problems. Base of the tongue. Tumors on the base of the tongue are usually larger when diagnosed because in the early stages the tumor is difficult to see. The only early symptom is ear pain. Voice changes and difficult swallowing occur later. Because the base of the tongue cancer is diagnosed later, the cancer may have already spread to the neck. The affected lymph nodes frequently need to be removed. Radiation therapy, including intensity modulated radiation therapy, stops cancer cells from dividing and slows the growth of the tumor. Radiotherapy also destroys cancer cells and can shrink or eliminate tumors. Intensity modulated radiation therapy allows the use of more effective radiation doses with fewer side effects than conventional radiotherapy techniques. Radiation therapy involves 5 to 6 weeks of daily treatments. Chemotherapy is prescribed for different reasons, together with radiotherapy as an alternative to surgery, called chemoradiation, after surgery to decrease the risk of the cancer returning to slow the growth of a tumor and control symptoms when the cancer cannot be cured. Palliative treatment